Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Peripheral neuropathies without the sensory loss. So under the peripheral neuropathies without sensory loss, we'll first look at the symmetric weakness. So which has a symmetric weakness? So when you look at symmetric weakness, it is a spinal muscular atrophy. So the spinal muscular atrophy. There is presence of spinal muscular atrophy. Then comes a hereditary motor neuropathy. So there is hereditary. There is hereditary motor neuropathy. Hereditary motor neuropathy. So in terms of hereditary motor neuropathy, it includes a distal. It includes the presence of distal. There is distal spinal muscular atrophy. Spinal muscular atrophy. Distal spinal muscular atrophy, or the atypical Charcot-Marie tooth disease. So the asymmetrical Charcot-Marie tooth disease. So we are calling it as the CMT, Charcot-Marie tooth disease. Now this is all with the symmetrical weakness. Now let's look at the asymmetrical weakness. Now when you look at the asymmetric weakness, what is involved? So in terms of asymmetric weakness, there is a motor neuron disease. It is a motor. There is a motor neuron. There is a motor neuron disease. So asymmetric weakness, it involves a motor neuron disease and the progressive muscular atrophy. There's progressive muscular atrophy. There's progressive muscular atrophy. And then comes the juvenile monomelic atrophy. There's a juvenile monomelic. There's a juvenile monomelic amyotrophy. And this is nothing but the Hirayama disease. This is nothing but the Hirayama. So the Hirayama disease. This is nothing but the Hirayama disease. Next, what else is there? There is a multifocal motor neuropathy. There is also involvement of the multifocal motor neuropathy. There is a motor neuropathy. And lastly, with the asymmetrical weakness, what do we have? There is a multifocal acquired motor axonopathy. There is multifocal acquired motor axonopathy. To learn and grow daily like this, please do subscribe.